is related to the respiratory system tonight. Is there anybody here tonight that wasn't here last night? All right. The diseases related to the respiratory system. And we need to do a little anatomy on the subject in order to understand the nature of the disease and how it can be approached. The respiratory system is quite an easy system to understand once you comprehend its basic nature, which is the main windpipe that links it to the upper respiratory tract, which is the pharynx. And of course the windpipe has ribs of cartilage which stop it collapsing with any sort of pressure put against it. The surface of this tube or windpipe or trachea is lined with a mucous membrane which has special qualities, and therefore we should need to understand something of these qualities. If you were to look at this lining enlarged under a microscope, you would find that it was made of sort of columnar cells. By that we mean cells that look as if they're like columns of a Greek temple. And pointing into the tube, you have from the surface of these cells what we call cilia, finger-like processes that point into the tube. And with the accumulation of mucus, phlegm, or materials which we would regard as thickened sort of saliva, there is movement of these cilia constantly upwards, moving upwards towards the throat. And this is a natural phenomenon. These cilia move in wave-like movements. The material lying on top of them, the phlegm or the mucus lying on top of them, is gradually shifted up into the throat. And then a tickle reflex takes over, and the person either will cough the phlegm up or the mucus up. If it is not contaminated, it's mucus. If it is contaminated, I suppose we could call it purulent material or phlegm. Now, that is a perfectly, or we may swallow it, whichever depends on whether you're asleep or whether you're speaking or whatever you're doing. And that's the healthy process. Certain disorders are related to a disruption of this mechanism. For instance, in bronchitis, the constant inflammation of the lining of the tube of the trachea and its minor branches leads to a thickening of this mucous membrane and a disruption of this process, so that some of the cilia are, as it were, either paralyzed or are worn away or are replaced by cells without cilia, so that the mucus slides back down the trachea into the lungs, and these people tend to get an infection of the material and the lining, getting tracheitis and bronchitis or bronchitis. Similarly, in the condition known as carcinoma of the lung or cancer of the lung, we get, as it were, such irritant material in the form of smoke, constantly stimulating, irritating these, if you want the word for them, pseudo-stratified columnar epithelial cells. And they become, as it were, so irritated that when they multiply abnormally, losing their cilia and gradually becoming cancerous. They will grow haphazardly beyond the hold of the etheric matrix and slowly crowd in and close up the air passages, producing, as it were, the typical picture of carcinoma of the lung. The person then ends in a state of cachexia, C-H-A-C-H-E-X-I-A, cachexia, which leads to starvation, or a sort of malnutrition state in which they're depleted, they're lacking in energy, they become thin, emaciated, or the material, the carcinoma material, will erode a blood vessel, and the person will suddenly have a haemorrhage in which the lungs fill with blood and they virtually drown in their own blood. So this is carcinoma of the lung, and this is bronchitis. The irritant in the case of the bronchitis is, of course, sulfurous fumes in the atmosphere, smog. Any industrial pollution will lead to a thickening and inflammation of the surface of the trachea, the lining of the tubing. Then we go a little lower and we talk about the bronchioles. There are the right and left bronchus where the windpipe divides, still with its cartilaginous or gristle arches, keeping them patent from pressure, collapsing under pressure, and then we have the substance of the lungs. Now, ultimately, these bronchi, the right and left bronchi, branch into smaller tubes which are called bronchioles. And each one of these bronchioles supplies one lobe of the lung. There's a lobe supplied by a bronchiole, another lobe there supplied by one, and one there. So each lobe of the lung has a bronchiole supplying it with air. And of course, along with the bronchiole there comes in arteries, and out come veins. The bronchioles have got wrapped around them muscles, smooth muscle, which enables the bronchiole to be contracted or relaxed, dilated or constricted. And in general, the sympathetic and parasympathetic nervous systems will dilate or constrict the bronchioles by means of these muscles. At the end of the bronchioles, we get branchings of the tube into air sacs, and an air sac which is possibly just visible to the naked eye may be as large as a pinhead, and there are millions of them. The air sacs are made up of alveoli, these bulbous looking structures, and the air comes down the duct from a bronchiole and enters an air sac, and that would be the size of a pinhead, as it were. These air sacs contain a single layer of cells. They look like a bunch of grapes, as it were, a bunch of grapes, each alveolus being a particular grape, as it were. And the whole lot has a blood supply that comes in, branching itself over the alveolus and ending in capillaries, and coming away from the air sac, we have the venous drainage, and this is the site of respiration. This is where gas exchange occurs. Through the very, very narrow wall of the alveolus, oxygen passes from the air into the blood, and carbon dioxide comes out of the blood into the air sac. And this is air exchange, gas exchange. And last night, when we talked about alkalosis and acidosis, we were referring to this particular region where alkalosis and acidosis could originate. And we mentioned then that some respiratory disorders, where there are upsets in this mechanism, could produce the acidosis and also alkalosis. And in fact, this is the subject of the first condition I'm going to talk about tonight, and that is the topic of emphysema. Emphysema, a very well-known condition that you're likely to come across, emphysema. And the typical emphysematous person is a person with a large barrel-like chest. The barrel is there whether they themselves are large or small. It's a barrel-like chest. And have we anything here tonight? This is Dr. Francis's great moment. Where are the, well, they have to stay there until they are put into my hand, that's all. Right. We will wave that aside for a moment, and we will talk about the emphysematous. If I might be permitted to put up my usual drawing of the human anatomy, somewhat emphasized, then the barrel chest is the one that looks something like this, a barrel-like chest. It is as if the ribs have been grossly expanded and the person has a barrel-like chest. This is the barrel area here. And this is very characteristic of emphysema. The word comes from the Greek meaning overinflated. Overinflated. And we mean by it, of course, that the air sacs that we saw a little earlier, I think what we're going to have to do is to ask the lads to remove this drawing and put it somewhere else. You can look at it. That can go on Dr. Francis's blackboard, then we will have achieved some use for the board. And so, we are talking about overinflation of an air sac. Overinflation of not an air sac, but many of them, millions of them. Now, the way to think of this is that the air sac has, as it were, suffered some traumatic damage. If that's a typical air sac, then it has undergone some damage. And what has happened is that the air sac has broken, it has been next to another one, and because of a history, as it were, because of a history of material having got caught in the bronchioles, there has been overinflation of these air sacs, and the result is that they break into each other, and you get a lot of air spaces forming, and the problem is that they can inhale quite easily, but they can't get the air out quick enough. They can't get it out. And they have difficulty. They have difficulty in exhalation, in breathing out. The sacs, the different air sacs, burst because of this, and the result is that they've always got stale air in their lungs. They've got stale air. The air can't get out the bronchioles that are left, and so they get stale air. With the breakdown of these very, very delicately constructed air sacs, where you have literally sheets of cells only one thick, allowing the oxygen and the gases to exchange, with the breakdown of these walls of the air sacs, you get, of course, the fact that they can't oxygenate. The gas will not exchange. The oxygen can't get into across the walls. You've got to have a wet surface for any gas exchange to occur. If you were to take all the linings of these air sacs and spread them out from your lungs, they would total the area of this room. And this huge wet surface of the lungs allows oxygen to be taken through it and carbon dioxide to be brought out. Now, with emphysema, a lot of these linings, the walls, tear down, break up, and so they can't oxygenate. And they therefore are in a position of having large chests which are full of air, can't get the air out, it's stale, there's little oxygenation, and the result is they can't get rid of carbon dioxide. They're short of oxygen, and they've got too much carbon dioxide. And if you remember from my work last night, I said that carbon dioxide blown into water produces carbonated water or carbonic acid. Carbonic acid. Carbon in water produces carbonic acid. And therefore, they tend to suffer from acidosis. And I've particularly chosen this condition tonight to follow on last night so that you have an understanding of what acidosis is. So what is the overall result? A person in front of you who is always short of breath, not just when he is exerting, he's always short of breath. And the result is that the heart, because of the lack of oxygenation, the heart has got to work twice as hard. Has to work twice as hard to pump the blood around, as it were, twice as much to get the same amount of oxygen, because they are half efficient in carrying oxygen. You tend to see this mostly in people from the age of 50 to 70. The cause of the condition, usually smoke, inhaled smoke. By that I don't mean cigarettes so much, but the polluted atmosphere, inhaled smoke, inhaled irritants. This taking in of sulfurous and carbon material, sooty material, acts on the cells that we've just been talking about in the bronchi, and they produce too much mucus. Excessive mucus is produced because of a constant irritation. And this mucus can't be got rid of, and it clogs up these little tubes here, these bronchioles here, and when they try to breathe out, they can't. And the result is that the air won't go out. It comes in all right, but it won't go out, and the result is that these break, and there's continuous, as it were, degeneration of the tissues and less oxygenation. Now, the treatment for the condition. Well, there's no known medical treatment. And the reason is that you cannot replace the elasticity that has been destroyed. Where you get elastic material in the lung tissues, which has been overstretched, it's like a balloon. You blow up a balloon excessively, and eventually its elasticity is lost, and you can't replace that. And so what you have to do is to try and teach them any procedure which will help them get more oxygen when they're not getting enough of it, help them to get more oxygen, and teach them to be, as it were, very careful about anything to do with respiration. If they live in smog areas, get them away from them. They've got to move. They've got to literally get out of a smog area. It's no good. If they are smoking, they've just got to stop it. Their lives are in danger. They must know that their lives are in danger because they are increasing the amount of mucus produced and aggravating the condition. They have to be careful how they wear belts. If the belt is too tight or too high, it is pushing the diaphragm up, and the diaphragm can't work properly. The diaphragm is responsible in normal people for 60% of the air that we breathe, and it's like a piston. There is the piston, and there is the thoracic cage, as it were. And when we breathe in, the piston comes down, or the diaphragm comes down, sucking air in through the windpipe. And if you've got a belt here and it's tight, then it means the piston can't get down, and the amount of air that is being taken in is restricted, as it were. So that sort of thing has to be watched. What we suggest from an esoteric point of view is the use of oxygen, and I should think that you have to get oxygen under a doctor's prescription over here. Oxygen, of course, but the use of ionization. By that we mean ionized air. And we're going to have a look at an ionizing device tonight that I have used, and it's so very simple that one should understand that it's easily obtainable. The other thing that can be done, of course, is today, anyway, it's possible to get oxygen therapy and to even be able to walk around with an oxygen cylinder. They're now making oxygen cylinders that can be carried in a bag, a shoulder strap, and weighing about 11 pounds, so that if you go out somewhere, you can have your oxygen cylinder nearby. And these people are desperate for oxygen and get panicky if they have to go out and leave their oxygen cylinder at home, which they have to do normally, and therefore they have to have oxygen. Now, we say oxygen is fine, nothing wrong with it, but there is a problem that we're going to deal with in a moment. So we advise negative ionization of the room that the person rests in. They must be able at home to be able to go into their room and know that it is ionized there, and for them to be able to, as it were, have the relief of this. How negative ions work, we don't know. I am merely recommending that they be used. Now, the oxygen therapy, of course, would be perfect if it wasn't for one difficulty. And that is that, generally speaking, the oxygen that is placed in a cylinder under pressure and stored, something like, what would you have in a cylinder? 1,000 liters of oxygen in a little cylinder. Well, that's all right, but the oxygen lacks the vitality globule. And we would have, therefore, the patient drawing in his oxygen, which is good, render unto Caesar that which is Caesar's, and the physical body needs oxygen, but the oxygen would be lacking in vitality globules. And the only thing I can say at this stage is experimental work needs to be done so that when the cylinder is being used and the air is being taken off into the oxygen mask, it would be a good idea, whenever possible, to have, as it were, a shunt so that the oxygen could pass through a glass spiral, which is bathed in sunlight wherever possible before it is inhaled, giving a possibility of the oxygen to be, as it were, linked up with vitality globules. Thus, the patient would not be deprived of his prana. The difference between having oxygen of this kind and oxygen laden with prana is patent to every one of us when we travel in an aeroplane. And the exhaustion that most of us feel is the result of having oxygen that constitutes a large percentage of our intake of air, which has not been given the opportunity to have vitality globules attached to it. And somewhere, somehow in the future, research will show that the oxygen that is going into the pressurization of the cabin should somehow be exposed to that gorgeous smog-free atmosphere above the clouds where the vitality globules exist in profusion. And if the oxygen could be, as it were, submitted to linkages with vitality globules, then much of the distress that people suffer from air travel would be overcome. Now, there is also something else that you can use as a general method of esoteric therapy, for all conditions where there is lack of oxygen and lack, therefore, of prana. And this is to sit the patient on a chair under a window which the sunlight is streaming in. Sunlight is streaming in. Sit the patient on the chair. Arms can hang forward, the back like that, and the legs somehow like that. Got the idea. And the sun is literally pouring onto the naked back, and in front of the patient you hang a violet drape like that. Get a good violet, it must be violet, and the violet should allow the sunlight to strike it, and the violet should be reflected back. The violet color should be reflected back onto the naked body, person sitting there in that position. And if you have, in addition to that, ionized negative ions, that is O2 negative, not only that, but electrons and so on, an ionized atmosphere, this can be very good as a general treatment for respiratory problems. Are there any questions about the subject of emphysema? Generally, generally speaking, in emphysema, the body tries to compensate. It will multiply its red cells enormously. They will go up from 5 million, 6 million, 8 million, 10 million, 12 million per cubic millimeter. And the body is desperate to try and compensate for the oxygen lack. So this is one of the characteristics of it. Yes, Bonnie?
How long?
I would say that if they could manage to do that half an hour in the morning and half an hour in the evening. It's most important to do it in the evening, because this is the time when the atmosphere is more saturated with vitality globules than in the morning. As C.W. Leadbeater used to often say, an hour's sleep before midnight is worth 2 hours sleep after midnight. And he said the reason for this was because the atmosphere was saturated with oxygen with vitality globules after the long sunny day. And if you go to sleep at the end of the long sunny day, you are inhaling vitality globules and you are using them better when you are asleep and relaxed than at any other time. By the time the morning comes, the vitality globules tend to have been dispersed, and people who sleep late, go to bed late at night and get up late, are people who have got prana problems. Now I know that, and I can tell that to people endlessly, that it won't make the slightest difference. If they go to bed late, they will go to bed late, and it's bad occultism. It's bad occultism. Never mind the esoteric health aspect of it. Did I answer your question? Yeah, they can do it I'm talking about sleeping now. This process, yes, can do it. The later in the afternoon, the better. As the sun is level, is a good time as well. Yes, the violet, of course, is radiating the person's body, and do remember the effects of the violet ray, the seventh ray. The devas are attracted. The devas are attracted to the healing room, and they are the great repairers. They are the great repairers and restorers of the etheric nadis, and even if the lung tissue is torn physically, there is still etheric tissue there that needs to be nurtured and kept absolutely sound. Isn't it lovely to be able to talk about these things in a group that knows something about the subject instead of having to explain everything? Yes. If you've read my books, you know about the violet ray, the seventh ray. Seventh ray physical bodies have no problem so long as they can get access to the sunshine. Yes, and they bathe themselves in it and they love it. Other people can't necessarily have the sun. First-ray physical bodies are sensitive to the sun, but they're less likely to suffer if they can have what I call a violet ray bath. A violet ray bath. Questions? Yes. The karma of it, I don't know. I don't know. I'll get on to it sometime, but I don't know. I do know the karma of most of the conditions, but I'll tell you when I don't know, and I certainly shan't make it up for you. Question. With the machine, we should what? Can't hear. Oh, should the door be closed? Yes. When you use an ionizing machine, you should, as I say, sort of have your bedroom in such a way that dust particles are not going to get in. The less dust in the room, the better, from the point of view of ionization. And even the clothes you wear can be conducive to negative ions, or they can be resistant to negative ions. And so one has to go into the whole subject. I'll be getting some material over on ionization, and in subsequent seminars we'll deal with this quite extensively. We are, of course, going to do another one of these before I go back to England, which would be somewhere late in May. Questions? Yes.
Windows shut also?
When to shut?
Windows shut also with no
Oh,
ions.
windows shut with negative ions, yes. Do you remember that the hot, dry, windy atmosphere of Dallas, dust-laden, is positive ions, positive ions. When you get that lovely shower of rain, and just after the rain, when the air seems so bright, when I say bright, I mean alive, these are negative times, negative ions. Negative ions are reputed to be good for I'm making no claims here. I'm merely repeating some of the current literature. Negative ions for wound healing and for asthma and other things like that. Questions?
Negative ions aren't maybe particles that in the end.
Nope.
Inhale them long enough, give you a very high feeling of well-being.
Well, there is a euphoria, yes. The action of the negative ions is not understood. The esoteric explanation, since you have asked me for it, and I haven't quite completed my research on it, the esoteric explanation is that the negative ions balance the two snakes of the Ida and Pingala about the central rod of Sushumna. The two etheric tracts are balanced. And with their balance there comes coordination of sympathetic and parasympathetic. And this, when you get the, as it were, the balancing of these two systems, things like the bronchial tubes are affected, sweat glands, all sorts of organs over the body for maintaining homeostasis are given a sense of order by the sympathetic nervous system, and that results in a sense of euphoria and well-being. Of course, there can be excessive use of negative ions, and we will go into that at some other time. I want to go on now to the sister complaint, as we're on to respiratory disorders, and talk about bronchiectasis. Bronchiectasis. Shall I put the word up on the board? I think that's about right, something like that. Bronchiectasis. Now, what is bronchiectasis? Well, in bronchiectasis, we get dilation of the bronchial tubes through the obstruction of foreign bodies, And the tubes, instead of being thrown into nice air sacs, like the ones we've been talking about, nice bulbous air sacs, the tubes become elongated and the air sacs are lost, and they become, as it were, repositories for mucus, and then infection leading to pus and other sort of infections. It's very common to get bronchiectasis after children have had a history of lung infections, pneumonia, a pneumonia that usually comes after flu or with flu. Sometimes flu will end in pneumonia, and the pneumonia that frequently accompanies measles. Measles in a child can very frequently lead to pneumonia. And here it means dilatation, the bronchiectasis means dilatation of the tubes, the bronchial tubes. Whereas before we were talking about the breaking down of the air sacs and the emphysema and the accumulation of stale air leading to acidosis, we're talking here about the tubes being excessively dilated. And so we get people with bronchiectasis accumulating pockets of pus in their lungs, in these tubes that become evil smelling, and they are constantly coughing up large amounts of sputum, and occasionally the sputum may even be blood-stained where there has been rupture of some delicate part in the lungs. They have paroxysms of coughing because of the amount of sputum and mucus that has accumulated in the lungs. They have difficulty getting rid of it. This condition can quite easily be caused by small children inhaling peanuts that block the bronchial tubes. A bronchial tube gets blocked off, the peanut gets wedged in here, and the result is that the absorption of air in the tube leads to infection and so on. And a characteristic of the condition is a fetid breath, an evil-smelling breath, and they can be an embarrassment to everyone around them. And it makes them miserable. They can be invalids all their lives, and they can live into old age. A very, very misery-producing condition. Usually, medical science is able, and of course, always with these conditions, they should be under the doctor. Usually, medical science can locate a lobe which is affected. We talked about lobes a little earlier, and we saw how each lobe was fed by a bronchiole, and if the lobe that is, or lobes which are causing the trouble can be located, then they can be excised, they can be cut out and removed. If they are cut out and removed, there can be, as it were, a very dramatic improvement in the person's condition. But that's not always possible, and especially in older people, and therefore what must be done is to try and drain these pockets of pus, and what I'm suggesting you do here is the usual method of lowering the patient in such a way that, if that's the bed, try and draw a bed, you place the patient in such a way where his head can be down and the pillow placed there perhaps, and the position that he adopts is dependent on which lobe has become filled with this foul material. And according to the lie of the lobe, you can usually get the material to flow out through the mouth, and it can be collected, and if necessary, tests be done, and so on. But that's the usual method of drainage. They lie in a position where the lungs point downwards and the material can slide out through the... but that isn't always easy, and in England we found it a good idea to place vibrating units, small vibrators which were at the same time magnetic, on the back, so that very, very gently the vibration would loosen the material and allow it to come sliding out quite dramatically. And if you come to the festival in England, I will be demonstrating how this can be done. The application of these magnetic vibrating solenoids, only about that size they are, and they warm up, and they can be laid on top of the patient thoracic cage, and especially over the lobe. Generally speaking, the doctors know which lobe it is, and they'll tell the patient, and you can pick that up from them and locate the site and gently vibrate it. Now, that is the sort of treatment that will constantly pull out this material. Another thing that you can teach them to do, of course, is breathing exercises, which will always help, especially when they can do breathing exercises where the air is saturated with sunlight. Don't expose them to the cold. They're always sensitive to colds and things and infections. And when they breathe in, teach them to do the full inflation of the chest and holding it for some time, pounding the chest like that, so that the air spaces and the places where the mucus and infected pus has accumulated can be loosened. They could do that a few times before you get them down, helping them to drain out the material. Always remembering they should be under medical observation. It's a sort of condition that the doctor would welcome outside interest in, because it drags on for most of the life, and it can be very productive of misery in the patient. They don't like to have to suddenly withdraw from a room and have to cough up half a cup of evil-smelling, yellow-green, purulent material. Are there any questions about bronchiectasis? We're going to go on now then with, whilst we're on the subject, I might as well pop it in here, talk about the subject of carbon monoxide poisoning. Carbon monoxide poisoning. It's a condition that is comparatively rare. It can occur, though, with such insidiousness that it can be quite frightening. The story is told, and it's a perfectly true one, of a train filled with people in Italy during the war years on its way to Rome, entering a tunnel, and the train produced a vast amount of carbon monoxide, and very slowly but surely 400 people on the train went quietly into cyanosis, which is loss of oxygen, and fell asleep, as it were, senseless, and died of carbon monoxide poisoning. It typically occurs in modern times, or in our own day, in establishments where a live fire is in the room. It can happen in a hunting lodge. It can happen in the best of homes, where it's been cold and the windows are all closed. The fire burns brightly and then goes into a sort of into a half-live state, and in this condition the slow-burning grate can change its physical mechanism of taking up oxygen and produces not carbon dioxide but carbon monoxide, and people can be sitting around the fire dozing or reading newspapers, and each one slowly goes off into a sort of coma, and the whole family can die in one room. And so one is possibly likely to come across this condition occasionally, and it's worthwhile learning to prevent it, always by teaching your own family and people around you. Can you prevent accidents? Can you prevent disease and disorders by banishing ignorance? Always remember that the second ray focuses mainly on the sign of the zodiac Gemini, and mainly through teaching. Healing is accessory to it, and much healing can come in the world as the result of teaching people not to be ignorant and stupid over the way they conduct their lives. In England, certainly after road accidents, it's the commonest cause of accidental death. Accidental death. Of course, it goes with suicide. It goes with suicide. And the method of channeling the exhaust fumes of a car into an enclosed cabin, producing carbon monoxide poisoning, is a very, very frequently resorted to method of destroying a person's life. What happens is that the red pigment in the blood, which takes up oxygen through the walls of the air sac, and there's the oxygen. The red pigment, instead of taking up oxygen, prefers to take up carbon monoxide, CO. It has, I think, something like 250 times greater affinity for carbon monoxide gas than it has for oxygen. This hemoglobin, the red pigment of the blood, prefers carbon monoxide 250 times more than it does oxygen, and it takes it up. The first thing that you notice with a person suffering with carbon monoxide is a bright cherry red complexion, And they suffer from anoxia. They can't take up oxygen because all the hemoglobin is linked to carbon monoxide, which is no good to the body, no good at all. The first sign that carbon monoxide is poisoning a family, sitting beside its fire, is lassitude. They couldn't care less, not interested in anything that's going on in the room. Headache and nausea. And then as the amount of oxygen being supplied gets less, and the poisoning increases, the pulse rate increases, the respiration rate increases, the weakness increases, and there is diminishment of vision. You can't see very well. There's no blood supply to the eyes, or rather oxygen supply to the eyes. And they go into coma. The respiratory center is depressed, and death ensues. And the great characteristic is cherry red color of the skin and the mucous membrane. You pull open the lips, and the mucous membrane is this bright cherry red, something like what this young lady is wearing here, the jersey that you're wearing. You better stand up. Come on, this is your moment. Stand up just a moment. That sort of cherry red. All right. What do we do about it? The first thing you do, of course, is to get them out of the carbon monoxide. Pull them right out of it, straight away. Smash a window, get them out through it. Any obstruction, get them through it. And then try and get pure oxygen to them as quickly as possible. Get pure oxygen to them if possible, if not just fresh air. Now, carbon dioxide in the oxygen will stimulate the respiratory center. Obviously, you can't do this with your normal facilities. But if you've got a mixture of oxygen and carbon dioxide, it would stimulate the respiratory center, make them breathe oxygen, and help to pull them through. If desperate, if they have stopped breathing, then you must try mouth-to-mouth breathing. Mouth-to-mouth breathing. Perhaps in a later seminar, we can demonstrate mouth-to-mouth breathing if we can find a suitable volunteer. But it can be life-saving, and more recently, mouth-to-mouth breathing has become far more favored than other methods of forced breathing. Put the patient to bed for a good while, much longer than you might think. Sometimes they get up too early and they suffer from shock. Several days in bed. Keep them warm, hot water bottles, blankets, just as if you were treating them for shock. Be absolutely sure the respiratory passage is clear. And if there's any difficulty when a person is in this state, pull their necks right back, lay them flat, pull their necks right back to see that the respiratory system is kept clear. The only chance of it becoming blocked is material in their mouths and or swallowed, and if you pull the neck back, the pharynx, the oropharynx and the buccopharynx are open and the air can pass straight down into the tube. But you've got to pull their necks right back for that. Be sure to remove dentures, anything that can obstruct. Now, the tissues suffer from oxygen lack for some time, and there may be frequently brain damage. Doesn't matter who suffers from this, there's a good risk chance of brain damage. If the brain damage is bad, they suffer from dementia, just as if they were aged and there'd been brain softening and they were suffering from senile dementia. But it's a dementia produced by destruction of some of the cells of the brain. Quite often there's cardiac damage to the heart, and so on. What can we do for them? Well, what we can do is to teach them kumbhaka breathing, and by that we mean compression of breath again, always being careful that they don't produce acidosis and alkalosis. I'm talking about long term now, months after the thing has happened, when they're no longer having medical attention and they're still suffering from the after effects of this. What do? We believe esoterically that given normal attention, that etheric tissues will quite often survive when physical tissues have been destroyed. And if it is possible to teach them kumbhaka, where there is the holding, squeezing of the breath, as it were, in the rib cage, this can assist the nadis to regenerate, And where nadis, remember, they are a filamentous lattice work of white, silver-colored threads. Where they are patent, there can be regeneration of tissue. As far as the brain is concerned, that is very, very difficult. But you should, in any case, teach them breathing exercises. So we have considered the carbon monoxide poisoning in 2 respiratory conditions. And after the break, I'm going to go into the subject of alcoholism. Well, we come now to the subject of alcoholism. It has a very peculiar karma, and I'll be discussing it in a moment. And it is a subject of intense interest at this time, and parallels to a great extent the subject of depression. Thank you, Myrtle, dear. Very sweet. In depression, of course, you remember that the main problem in endogenous depression is that there is difficulty in expressing the love rays. 2 kinds of ray types, where there is a great preponderance of love rays that can't be expressed, and in types where there are very few love rays and they can't be expressed. And the 2 extremes tend to produce the endogenous depression type. Now, I know I haven't done that in this seminar. I did do it in the Diploma of Esoteric Science and Psychology. And so, at some later stage, I will do depression again specifically for this course. Alcoholism. It's important at the outside to remember that although we may think differently, alcoholism very seldom produces neurosis. There's only a small percentage of them go on to have a neurosis. The degree of alcohol at any given time is usually measured from the blood, the amount of alcohol in the blood. Of course, our concern is often with how much alcohol makes driving dangerous, and we're inclined somewhat lately to overlook the problem of the millions of alcoholics who are spread all over the land. Always remember that your closest friend might be an alcoholic, and any patient that comes to see you might be one. They are, after a long time, after chronic alcoholism, they are very clever at covering up their condition, and in most instances they are wise to cover it up. Not always, but they are wise to. Generally speaking, we measure the alcohol in the blood, and one describes, as it were, the various conditions of or symptoms of alcoholism in terms of how much there is in the blood. And so we say that if there is 100 milligrams, 100 milligrams of alcohol in 100 milliliters of blood, 100 milliliters of blood, then the person is dizzy and delightful. Dizzy and delightful is the usual expression for it. If there's twice that amount, 200 milligrams, the same amount of blood, then we get drunk and disorderly. Drunk and disorderly, which is an English army term. I don't know whether they use it out here, but it's an English army term. Where there is 300 milligrams, 3 times, dead drunk, inert, immovable, and so on. And 400 milligrams, death's door. They're at death's door, with the possibility of respiratory paralysis at any moment. The respiration can become paralyzed at any moment. And so I'll go over them again just quickly. 100 milligrams, dizzy and delightful. 200 milligrams, drunk and disorderly. 300 milligrams, dead drunk. And 400 milligrams, death's door. Coma usually occurs when the alcohol blood level reaches about 300 milligrams, which, going back, coincides with dead drunk. Now, the great question, of course, is what constitutes the dangerous level for driving. That's how it affects most of us. And this can never be determined for sure. And various states and countries have levels which are arbitrarily decided. A man may carry a lot of alcohol and be able to drive with no apparent motor lack of coordination, and another can have half the amount of alcohol in his blood and drive the car all over the place. And so we are faced with this extraordinary problem of alcoholism. It can, at its worst, lead on to, when we withdraw it from a person, delirium tremens, and it can complicate all sorts of conditions leading to collapse of the blood system, excessive overheating of the body, and trauma to organs, damage to organs, and so on. We're not going to go into all that tonight. I merely want to highlight some of the more important features of it, and those that concern us most of all. We need some new thinking, and a very good pamphlet to look at in this respect is Scientific American, March 1976. The current Scientific American has got a pretty good article, a bit scientific, on alcoholism and the latest discoveries. Now, our concern as esoteric healers, our concern with the subject is that the alcohol cannot be stored in any tissues of the body except in the liver. And there it is, as it were, broken down. We don't get rid of it in the urine, we don't excrete it in the urine, and very little is excreted when we breathe out. I know a person's breath smells awful after he's been drinking, but in truth we don't excrete much through the surfaces of the lungs. Most of it has to, the overwhelming amount of it, has to be broken down by the liver. It imposes a huge burden on the liver, and it means that in the region of the liver you have all this calorie-laden material that has to be dealt with. It's calorie-laden material. It's no damn good to the body really, except just to produce a bit of energy, but it's calorie-laden. It has got to be broken down. It can only be done in the liver. The problem, of course, is that the liver has 100 other things to do. The liver does just about everything in metabolism. It builds up proteins, it breaks down proteins. It has to do with a huge variety of things, including clotting mechanism of the blood, and so on and so on and so on. And the truth is also that recent discoveries show that ancient wisdom has been right all along, that the worst has been found true of alcohol. It has a direct destructive action on the liver. A direct destructive action on the liver. People used to say that so long as you eat lots of vitamins and green vegetables and fruit, you're all right. Your liver will deal with the alcohol forever. It's not true. The wisdom of the ages, on the other hand, Leadbeater and teachings right down through the centuries, have warned that alcohol is a poison. That alcohol is a poison. And now, like smoking, we find it is just this, exactly what the esotericists have taught all along. We teach that it should be avoided, especially when you are treading the path, or if you have it at all on rare occasions, like entertaining people at dinner, then it should be imbibed in very lightly, very lightly. I have no hesitation in telling you events from my own life. I came back from the war like all the other lads, and it was no difficult for me to be able to drink a bottle of brandy at a dance in one night quite easily. And at that age and at that time, easy to get rid of it. If I have more than half a glass of wine now with a meal, I suffer excruciatingly from it because of my esoteric sensitivity. And, believe me, I would like an extra glass at dinner many times, but just cannot have it because it knocks me around. And that has been a tremendous change over the years. Do remember, when we talk about alcohol, that it was the esotericists who always said that tobacco was dangerous. Long before, I remember when I first came to the path, it was by no means certain that that smoking caused lung cancer. It was a moot question. In fact, it was the Royal College of Surgeons and Physicians in England, who was my examining board, who first brought it to the attention of the world officially in the 1960s that smoking was poison and dangerous and so on. Now, I'm going to give you my own observations of the effects of alcohol on man on the path. I would occasionally have a binge. Does that mean anything in America? A binge? I would occasionally have a binge meeting an old army friend just after I began to tread the path in the 1950s. And I can still record some of the ghastly effects that used to result even at that time of sensitivity. So let me enumerate them. 1. In the disciple, they frequently cause inflammation of the gastrointestinal tract, the alimentary canal, the tract of digestion, inflammation of its walls so that the liquids are not absorbed, and diarrhea is the result, and pain with it, of course, pressure pains rather than anything else. Diarrhea. Secondly, an increase in psychic activity, no doubt about it, an increase in psychic activity with any degree of imbibition of the material. especially of the brow chakra, no question about it, brow chakra activity. Number 3, acidosis. Acidosis, usually the next day. For me it was about 9, 10 o'clock in the morning. Malaise, feeling sick, this is part of the hangover syndrome, I suppose. Headaches, nausea. Fourthly, an exhaustion lasting 2 days that I never used to get, but only on the path, an exhaustion lasting 2 days. So that literally you were uncreative for 2 days, and that probably used to upset me more than anything, was the wicked, wicked waste of creative time involved in it. Nothing else really upset me more than that. Fifthly, and this could be some justification for its use, catharsis, the production of a catharsis, an emotional catharsis. I remember during the war years when it was currently a very clever thing to do to give the troops plenty of alcohol before a big battle or after a big battle or when things weren't going well and so on, that this used to have an emotional catharsis, and you could live with people a few days longer, a few weeks longer, in a tiny little dugout if you had been drunk with them. And this was a very real thing, Now, the catharsis was emotional, and it might have some application outside of the path, but certainly not on the path. Sixthly, very vivid dreams, very, very vivid dreams, especially of the waking type, and often filled with warnings, And as I have survived for 20 years my worst drinking hangover, I don't think that the dreams were meant to warn me that I had, say, fibrosis of the liver. What do you call it? Cirrhosis of the liver, right. Very frequently insomnia, the muse of angry men, the poets say. Insomnia, the muse of angry men, a man who's angry with himself. Seventhly, a disgust welling up from the deepest levels, must be recorded, a deep disgust welling up from the deepest levels. Eighthly, frequently hypoglycemia, low blood sugar, hypoglycemia. Probably through vagal stimulation of the vagus nerve by alcohol, leading to low blood sugar. 9, raised blood pressure, and with it, it seemed to be increased intracranial pressure inside the skull. And then, 10thly, it seems that in this condition on the path of having drunk alcohol, that elements of the dweller surface. That we dealt with this in the diploma, but it's not just a catharsis, it's as if the last dying shreds of your dweller have some manifestation. And this, of course, shows very frequently in number 11 in alcoholics, withdrawal, especially of alcohol, delirium tremens, where opening prematurely of the ajna center, the brow chakra, gives direct perception into the astral world and the sight of elements of the dweller on the threshold and associated denizens, if you like, of the astral world. Now that's an important observation, as you will see in a moment. I have talked to many alcoholics, and they seem to agree on a certain common pattern which goes in hand with it. But one alcoholic who has been rehabilitated made what I regard as a very relevant observation here with regard to the progressive degeneration that occurs as alcoholism becomes established, And I quote the words, "It seemed to me as if degeneration begins deep down inside you, and then it works outward from the deepest levels, and there slowly begins mental degeneration of attitude, and then there is emotional degeneration or astral degeneration. Then there is energy degeneration, which coincides with the etheric level. We can't get etheric energy through, it's all choked up in the astral. And finally, degeneration of the physical body itself. Degeneration of the physical body itself. The same person, whom I would remind you has rehabilitated herself, said when the process reaches rock bottom, that is, physical degeneration is active, it seems as if you are confronted with an overwhelming fear, and that's indicative of rock bottom being reached. And she said more than this, but a fear of fear. And many alcoholics have mentioned that to me. And then it would seem that if death and coma and or suicide does not supervene, it's just as if then that the process begins to reverse itself. And then there's the long struggle out of physical debasement into establishment of getting energy again, of emotional, astral integrity, mental rehabilitation, and finally the ability to live once more with the soul. A reversal of the process. The karma of alcoholism. Now, whereas in bronchiectasis and in emphysema, it isn't so important. In the alcoholic, they are people who are ready for this information. It can help them tremendously. You don't inflict it upon them, just as you don't inflict religion on an alcoholic. They will kick you out of the house with their curses if you go and inflict something else upon them as well as their alcoholism. But if you can gain a few calm moments with them, and they are esoteric anyway, the karma of the condition would interest them. And so first of all then, the karmic causes of alcoholism, the karmic causes of it. They have occupied positions in previous lives in which they have been the cynosure of all eyes, People have been in places where people have looked up to them, praised them, that they have abused the situation by being, as it were, hell have I put down here? Rare, I can't read my own writing. Oh yes, good heavens, englamoured. By being englamoured. And therefore, alcoholism is a disease of glamour. When you see glamour so widely spread in the world today, especially amongst discipleship, it makes you shudder. They have abused their situation by being englamoured with it. And this usually means that they have not used their position to good effect. And they have had fostered in them megalomania. And in this life they are debased. Position is reversed. In this life they are debased, and the focus of attention now is upon them once more, but with scorn and ridicule and contempt. Whereas previously they were the cynosure of all eyes because of their proud, elevated position and a position of respect, which they abused by not putting it to good effect and becoming englamoured by it, and megalomania. Now they are the focus of attention for scorn and disgust. And the alcoholic very frequently brings this out in his alcoholic condition in delusions of grandeur. It's a throwback to those lives. Delusions of grandeur, a megalomania, a karmic megalomania surfaces in them. Pretensions to greatness and grandiose schemes that never have a hope of being effected. So this is the karmic cause leading to the retribution. Now the karmic results of alcoholism. This produces the complete circle, the karmic results of it. And I can only choose one example tonight, and one that is probably thrust into our attention more than anything. And that is the karmic results of, for instance, drunken driving, where a death or mutilation or maiming has occurred as the result of the inconsideration of the individual. Drunken driving of a train, of a motor car, doesn't matter what. And it's difficult to explain it, and I can only explain it in terms of the vision that I had 3 or 4 nights ago when I put the subject to the ashram. There was a long road, highway, a freeway passing in front of me, a group of young children looking both ways to cross the road, hesitating at last, running across the road, and a car drove them down, coming at a breakneck speed, and ran them over and mutilated them. And then the next thing was a flash to a vision of a situation in which I, the alcoholic, after all, this is the question that I had asked, I was an alcoholic. How would my karma be affected? The experience that was given me then was of a huge train accident, The driver had been drunk. It's strange that we should have this, because there was suggestion that a driver had been drunk in England when very recently, less than a year ago, he drove an underground train deliberately, it is believed, into a blind alley, a wall, killing and maiming, and through the telescoping of the carriages in this underground, many, many people. And going back to the vision, there is this tremendous accident, and the dead are being dragged out of these telescoped coaches, turned upside down, and screams and wails and suffering and smoke and chaos, and hundreds of people gathering around there, screaming and crying and carrying on. And suddenly they go all hushed, and they turn round and look at me and call to me and say, "He's the only doctor here, he must take over." And suddenly I'm confronted with a situation, with my limitations, that I must go in there and I must take over the control of this whole ghastly situation, where I must amputate limbs to free people, where I must resuscitate, where I'm going to be pressed to beyond my capacities, and all the responsibility would be on me. That is the karma of alcoholism, the future karma, that where there has been indifference and callousness to cause suffering and pain, that individual will come back into situations where his responsibility will be unavoidable, so that the responsibility is such that all the fiber of the individual is called into play. It's the sort of thing that you must think about. I could stand here and talk for half an hour and never convey to you the horror of such a situation, where you can barely yourself survive the spectacle, but that you must go in and take charge of it and become the cynosure of all eyes, watching you to see that you don't make a wrong move, imposing upon you such heavy responsibility to save life and to make amends the destruction that you have caused in your alcoholic excesses in previous lives. A disease that stems from Atlantis. The direct effects of alcohol hit almost entirely all the organs related to the solar plexus chakra. Brenda listed the organs related to the solar plexus chakra. It was almost exactly a description out of Scientific American of the latest research discoveries. The liver, stomach, pancreas, the duodenum, gallbladder, the whole area around that region. These are some of the direct effects of alcohol as recently discovered. The liver is ultimately destroyed. The liver is ultimately destroyed, not because of lack of vitamins, but through the direct action of the alcohol on the liver mesenchyme. If you want a little bit of the physiology of it, or the pathology of it, here is a liver lobule. Here are the striations, the marks that you can see showing in a typical liver lobule, showing the way in which the bile passes down from channels to the bile ducts and so on and so on. Now, in alcoholic degeneration of the liver, that begins to replace most of the materials in the cells of the liver, fatty degeneration, and then the actual fibers beginning to be deposited there, which lead to the cirrhosis of the liver. Secondly, the small intestine. The small intestine. Here you have this long loop of the duodenum and the ileum and the jejunum, must be something like 15 feet long, and because of the alcohol in the intestine, there are the following factors. Malabsorption. The wall of the intestine won't abstract, remove the food, take the food away. Malabsorption. And so the food just isn't being absorbed into the body. The digestion is poor. The enzymes can't break the food down, so there can't be absorption. There's inflammation of the tract, a sort of enteritis, which means that the liquids that would normally be absorbed into the body, containing the food, the carbohydrates and proteins, the liquid passes on and creates diarrhea. Then there is the result of these, malnutrition. Malnutrition inevitably. Malnutrition, and with it, avitaminosis, lack of vitamins, avitaminosis. Then on the pancreas, pancreatitis, inflammation of the pancreas, resulting in a breakup and necrosis of the pancreatic tissue, failure to produce enzymes that can digest fatty materials, and so on and so on and so on. I have one or two last things to say with regard to alcoholism, and it's terribly important. I can only say this, that the years ahead, the centuries ahead, will reveal fear that is so terrible to them comes from astral levels, and it is a very, very real one. On several occasions, as the result of my ability to project in the astral world, to move about freely there in full consciousness, I have seen alcoholics, especially the young alcoholics progressing on to chronic alcoholism, undergo an experience in the astral world of which they have no direct memory, but leaves them with this incredible mounting fear as degeneration goes through all the descending cycles. I have seen alcoholics, especially after a binge, after a night of alcoholic intoxication, being attacked in the astral world by those who have previously been alcoholics and are now dead. These earthbound individuals that Leadbeater used to describe in other times as populating or frequenting gin shops where alcohol was sold to alcoholics, intoxicated people, that sort of person, now dead, still clings because of his attachment for alcohol to the earth plane, cannot go into devashan, cannot slip off his astral body. And in the instances that I have seen, these ghastly earthbound individuals attack the solar plexus chakra of those who have become inebriated. Astrally, the individuals scream for help, and short of the presence of somebody like myself, they have no defense against these malevolent entities that literally embed their their teeth, their mouths, into the abdominal region near the solar plexus chakra, which coincides, of course, with the liver, and where detoxification of the alcohol is being attempted by the body. They feast off the alcoholic astral counterpart of materials. And this fear eventually carries through into physical experience, waking consciousness, so that it is an overall pattern that adds to their misery, so that even though they have rationable, loving families of relatives about them who would love them and advise them, they still possess this ghastly fear, which is accelerated and accentuated by every relapse that they have into the alcoholic condition. How can you help them? May I give this tomorrow? Would it be a deflation? I'd like to give it tomorrow. Thank you, ladies and gentlemen.